Welcome to Pathagonia. This is Jay. Today we're going to talk about colon polyps. Thank you to Path Presenter for these slides. Here we see normal colonic mucosa, which is characterized by test tubes on a rack. As we zoom in closer, normal colon mucosa has a basally oriented nuclei with apical mucin to help lubricate poop. Next to it, we have these, what I like to call tall, dark, and dirty, aka tubular adenoma. We have stratified nuclei, we have mitotic figures, and we have apoptotic bodies, which make it dirty. This is a tubular adenoma. It's characterized by a KRAS mutation. Here, we have tall, dark, and dirty. But the architecture is finger-like. And we being fancy, we like to call it villus. So this is a tubular adenoma with a villus architecture. And if there's 20 to 80% of this villus architecture, we call it a tubulovillus adenoma. And anything greater than 80% villus architecture, we will call villus adenoma. We talked about tubular adenomas. Let's talk about hyperplastic polyps. Here we see not test tubes on a rack because they don't go straight down. We see some kind of serrations, frilliness, dare I say. This kind of reminds me of a frilly skirt. And these don't go all the way to the bottom. These tend to happen in the distal colon near the rectum and has no increased risk of colonic adenocarcinoma. However, here we have a sessile serrated polyp, SSPs, and these are serrations that extend all the way down to the base, leading to a dilation of the base or booting of the base. As well as we can see right here, there's some dilations. This is characterized by a BRAF or a CIMP phenotype, which is a CPG island methylator phenotype. They tend to happen in the proximal colon, in the right side or the proximal portion of the transverse colon. Now that we talked about hyperplastic polyps as well as SSPs, let's talk about traditional serrated adenomas. These are characterized by villiform architecture, as we can see in this close-up picture of a finger-like projection with loss of mucin and eosinophilic or pink cytoplasm. There are ectopic crypts, as you can see here, as well as slit-like serrations, kind of like a sawtooth. These are characterized by either a KRAS or a BRAF mutation. Now that we mentioned the common polyps, when you get a colonoscopy, you do it every 10 years when they only find less than 20 hyperplastic polyps, all less than 1 centimeter. You do it every 7 to 10 years if you find 1 to 2 tubular adenomas, all less than 1 centimeter. You do it every 5 to 10 years when you find 1 to 2 SSPs, all less than a centimeter. You do it every 3 to 5 years when you find 3 to 4 tubular adenomas less than 1 centimeter, 3 to 4 SSPs less than 1 centimeter, or a hyperplastic polyp that's greater than or equal to 1 centimeter. You do it every 3 years if you find 5 to 10 tubular adenomas less than a centimeter, any number of tubular adenomas as long as one is greater than or equal to 1 centimeter, a tubulovillus or villus adenoma, a tubular adenoma with high-grade dysplasia, which is higher risk of cancer, 5 to 10 SSPs, an SSP that is greater than or equal to 1 centimeter, or a traditional serrated adenoma. Now you do every year if you find greater than 10 tubular adenomas, and you do 6 months if you find a tubular adenoma that's greater than 2 centimeters and the GI doctor took it in piecemeal resections. Thank you for watching. If you liked, give it a like and subscribe. See you next time. Bye.